Hey, good afternoon. Dr. Gardner here with the Vein Institute, Chattanooga, Tennessee. I wanted to talk about restless leg syndrome. RLS, or restless leg syndrome, is a very common complaint that we hear people talk about. Basically, it's that uncontrollable urge to move your legs. Typically happens in the afternoon or evening when patients are lying down, typically trying to drift off to sleep. It's something that's very hard or almost impossible for them to control. A lot of times it's not the patient themselves that complains, but it's the partner that they're sharing the bed with who gets kicked all night that complains. It can disrupt sleep. It can be very problematic for patients. So a lot of times people will seek out medical attention for that. They will be put on different medications, amitriptyline, Requip. These are just some of the medications that can be used. What people don't realize is that a lot of patients that have RLS symptoms actually have underlying undiagnosed venous disease. And what happens is this contributes to their RLS symptoms. So basically, let's talk a little bit about RLS. There's two kinds of RLS. There's primary RLS. We really don't know what causes this. It could be a neurotransmitter in the brain, such as dopamine or something like that. The other thing, or secondary RLS, there's a whole laundry list of things that cause secondary RLS. When we start to look at those, we think the underlying physiology or pathophysiology that causes it is the ebb and the flow of the swelling. So when you look at this laundry list of patients, let's kind of go down that. Number one would be pregnant females. Well, what happens in pregnant females? Well, they're up on their legs, they swell, they lay down at night, swelling goes down, and they have restlessness. So let's look at another category. People that have renal failure. Well, okay, so what happens? They're on dialysis. They swell, they go to dialysis, the fluid is drawn off, and the swelling goes down. So it's the ebb and the flow of the swelling that causes the restlessness. So there's lots of other things, but veins is one of the top ones in that category of secondary RLS. And what happens with vein disease, and typically undiagnosed vein diseases, patients will swell during the day, and when they lay down at night, we're not fighting gravity anymore, swelling goes down. So let's think about that. When you're sitting or standing, the venous blood has to go uphill against gravity to get back to the heart. So fighting gravity all day leads to increased pressure in the veins, especially when you have faulty valves or vein disease. This leads to swelling. When we lay down at night, the venous blood doesn't have to go uphill anymore to get back to the heart, so the swelling tends to go down. So that's why there's a large population of people that have undiagnosed, untreated venous insufficiency that also have restlessness. So they do go hand in hand. Now, not everybody that has restless legs has problems with their veins. It could be one of the other things that we talked about. So one of the things that we do is we actually talk about this with patients, and if they do have underlying restlessness, I tell them that there's a good chance that they can notice improvement in the restlessness once we treat the underlying venous disorders. And that's what we see quite commonly. Like I said, it's a very common after treatment with our patients. I'm going to show you a quick video of one of our recent patients, and I happened to be talking to her about her restlessness, and she was kind enough to let me record her thoughts. So take a look, and if you have questions or if you suffer with restlessness, especially if you know you have issues with your veins, big bulging veins, redness, heaviness, fatigue, aching, night cramps, that's also another common thing. But if you have any of those symptoms, we're happy to see you. An ultrasound can help rule out that as a potential cause for your restlessness. So please let us know. Thanks. I am with our nice patient today. She had treatment of both of her legs for venous disease. We've got her covered up here for this video. So I understand you had restless legs as a problem. Can you tell me about that? How did it affect you as far as trying to sleep before the procedure?
I couldn't sleep before the procedure. I was up walking the floors or taking medication every 4 hours or something. I wasn't able to sleep at all until I had this procedure. And since I've had it, I've not had to take one pill, not one pill yet.
That's fantastic.
So it's working just great. It's working wonderful for me.
Good. All right. Tell me about the procedures. Were they difficult procedures?
No, not at all. I were a little nervous about them, but they were not painful at all, I thought.
Okay.
It really was very easy, easier than I thought it would be.
Perfect. Are you glad you did all this?
Oh, yes, definitely.
Good.
Definitely. Okay. And matter of fact, I've recommended some ladies that goes to church with me. You'll be getting some more patients.
Well, we thank you for that. So I appreciate you sharing your testimony. This helps other patients who might have similar problems with their legs.
Right.
Okay. Well, thank you.
Thanks.